Hello everyone, I am Huan. In this video, you will learn the physiological mechanism of depression and a new medical discovery in its treatment, ketamine. First, let's have a look at what is depression. Depression is a potentially life-threatening disorder that affects hundreds of millions of people all over the world. It can occur at any age from childhood to late life and cause severe distress and disruptions of life, and if left untreated, can be fatal. In order to understand depression, let's have a look at how our normal synapses work. This figure is showing a synapse for classic neurotransmitters. The initial step of synthesis is the facilitate transport of amino acids from blood to the brain, where precursors are converted via enzymatic reactions into transmitters, which are stored in synaptic vesicles, and finally released into synaptic cleft by a calcium ion dependent process. The rate of neurotransmitter release is dependent on the firing rate of the neurons, which means that the condition or drugs that alters the firing rate modify the release of the transmitter. A further important regulatory mechanism of releasing involves the somatodendric autoreceptors, since binding of the released transmitter molecules leads to reduced synthesis or further release from the presynapse, and synaptic effects are terminated by binding of the transmitters to specific transporter protein and reuptake into the presynapse, where they are metabolized by enzymes, for example, monoamine oxidase, or stored once again in the vesicles. So what causes depression? One is low brain serotonin activity. Well, we can see in this figure, there are three pairs of serotonin transporters. The first one represents a healthy one, where the transporter transports the normal amount of serotonin to its receptors. The second pair is from a depressed person. Comparing with the first one, we can see the significant decrease in either the transporter or the receptor. And the third pair is with treatment, which returns the depressed to normal. Another cause is low dopamine. Dopamine motivates people to take action towards goals, desires, and needs. Low dopamine can result in less likely to work towards achieving a goal. People with clinical depression often have increased level of monoamine oxidase A, an enzyme that breaks down key neurotransmitters, resulting in very low level of serotonin and dopamine. We can see from this figure, in a normal person, the MAO enzyme destroys only a small amount of neurotransmitter and left a large amount of monoamine neurotransmitter to combine with its receptors. While in a depressed person, most of the monoamine neurotransmitters are destroyed by MAO enzymes, and only a small amount left to interact with their receptor, and this may cause the depression to happen. According to the National Institute of Mental Health, 30% to 40% of depressed patients who generally don't respond to standard antidepressant treatment. Fortunately, our scientists have discovered the antidepressant effect in ketamine to overcome this incidence. So what is ketamine? Ketamine is used by medical practitioners as an anesthetic. It is sometimes used legally by people to get high. High-dose ketamine can cause hallucination in people which cause a person to see, hear, smell, feel, or taste things that aren't really there, or are different from how they are in reality. When it is sold illegally, ketamine usually comes as white crystalline powder. It can also be made into tablets and pills, or dissolved into a liquid. A number of clinical trial studies are currently being undertaken to assess ketamine as a treatment for depression. Early indications are showing good results. Ketamine can act efficiently as an antidepressant. Let's have a look at how the mechanism behind it. Ketamine acts as inhibitor for NMDA receptor by binding to the receptor protein NMDAR on the postsynaptic neurons, which prevents the neurotransmitter that released by presynaptic neuron to activate the NMDAR, and its metabolite called HNK increases the level of another neuronal receptor protein, AMPAR, which enhances the neural activity and results in antidepressant effects. Although ketamine may be an alternative treatment for many patients with major depression disorders who don't get better with standard antidepressant drugs, it hasn't been thoroughly studied for long-term safety and effectiveness. Here are the references. Thank you for watching.